Hello everyone, my name is Queen Nguyen and I'm working at Kaiser Permanent Hospital as an MLT. Today I would like to tell you about the Alanine Aminotransferase testing. Alanine aminotransferase is one of the enzymes that help the liver convert food into energy. It is also called ALT. An ALT test is also known as serum glutamic pyruvate transaminase test or an alanine transaminase test. ALT test measures the amount of this enzyme in the blood. It is found primarily in the liver, but also in small amounts in the kidneys, heart, muscles, and pancreas. It is often done for checking for the liver damage. When the level of ALT is high, it can be sign that the liver is injured or irritated and the enzymes are leaking out of the liver cells. For this ALT test, the blood is taken from a vein. Doctors can ask patients to stop eating and drinking for 8 to 12 hours before the test. Patients can talk to doctors about any medicines that they take because some drugs might affect the test results or tell doctors if they are or might be pregnant. An alanine aminotransferase test result is usually available within 12 hours. For males, the normal range is 10 to 40 U per liter, and for females, it is 7 to 35 U per liter. These ranges are different from lab to lab. Doctors will base on the patient's health and other factors to evaluate the result. This means in some patients, the ALT value is not in the normal range but may still be normal for them. However, the high levels of ALT may be caused by the liver damage. It is from conditions such as hepatitis or cirrhosis. It may be caused by lead poisoning, exposure to carbon tetrachloride, or very strenuous exercise, or severe injury to muscles. The high level of ALT can be resulted by many medicines, such as antibiotics, chemotherapy, aspirin, statins, and barbiturates. Besides that, in mononucleosis patients, this enzyme level can be high too, especially in young children. Spurs grow so fast that can cause mildly elevated levels of ALT. Evaluation and performance of a new method for the measurement of ALT on virtual system. According to Dr. Fernando Chaves, author global head of medical and scientific affairs, this having a very high quality ALT liver function screening test to assist doctor in diagnosis and treatment is critically important, as liver disease rates have been steadily increasing over the years. Both levels, normal and abnormal quality control of ALT, need to be run every shift before we can run patients. Patient sample will be spun after raw, then the lab tech will put specimen on the instrument. The visual chemistry product ALT slides quantitatively measure ALT activity in serum and plasma. The ALT result is in the linear from 3 to 500 U per liter. If the samples exceeding the upper limit of the linearity should be diluted and repeated. The maximum dilution for ALT is 15. ALT levels greater than 5 times the upper limit of the normal range suggest a potentially serious active liver disease process, and the workup should be initiated without waiting to confirm the persistence of abnormal ALT. If the ALT levels greater than 15 times the normal range, it indicates severe acute liver cell injury, and evaluation should be initiated immediately. In short, the biochemical, clinical, and epidemiological information presented so far suggests that ALT may be useful as a screening test for early detection of asymptomatic liver disease and possibly for other causes of premature mortality. Thank you so much for watching.